Hey guys, Dr. Morse, Injury Experts. Tough injury tonight for Tyreek Hill in the middle of a really good game. Caught an up and out route, and it looked relatively routine until he rolled over. And initially what you see is his left knee and then lower extremity, instead of pointing to the left or up normal, it was pointing to the right. So then you have to figure out, hey, is this an ankle fracture dislocation or is this a knee fracture dislocation, or hypothetically both? Now, initially you can't really tell just based on anatomy because either can technically cause that. But when they evaluated him, they went to his knee. So essentially what happened is the fibula and likely the LCL, this one right here, tore, this fractured, and then this rotated. And there's a very strong possibility that it also injured this, the MCL, as well as possibly the ACL. That's really the only way that this can completely turn, basically allowing the tibia to shift, causing the toes to be pointed that way if there's no injury to the foot or the ankle. Now, it was a pretty fluke play. It wasn't anything crazy. It was similar to Tank Dell's last year, and when he landed and his knee dislocated. Now, they immediately put him in an air cast, as you can see here, and they will cart him off the field. He will go immediately to the nearby local Trauma 1 center. He will undergo a stat CT scan, and if they need to, they will bring him immediately to the operating room if there is an injury to the blood vessel on the back of the knee, or if there's an injury to the nerve on the back of the knee. If those are fine, he doesn't need to go to the operating room tonight. They will eventually get an MRI, but those take a lot more time, and it's not in the sense of urgency to perform that tonight. This is very unstable, and the ligaments and tendons are likely torn, either 2, 3, or possibly all 4, meaning LCL, MCL, ACL, and possibly PCL. These are bad injuries. Best case scenario, he has a fracture, maybe a tibial plateau fracture, and maybe just 1 or 2 ligaments torn. But there are many worst case scenarios that we don't really need to talk about. But this is season ending, and these are very difficult to return from. The knee, think about coming back from an ACL. Now think about coming back from an ACL, a PCL, an LCL. There's so many things, especially at his age and how he plays his game. This is very difficult, not only to sustain, but to potentially come back from. But we're not going to talk about that right now. My initial concern is the integrity of the knee. If the blood vessels are injured, they have about 6 hours to repair those before the blood flow to the foot and the lower extremity gets compromised, of which then would lead to significant issues. The luxury of it happening on the field is they can immediately bring him to the trauma center. They're already calling it in. They're going to stat CT him, and then if they need to, they will bring him in the operating room, and they'll move everything out of the way because of this is one of the few medical emergencies that are orthopedic. We wish him the best of luck. I am here in Miami, and I'm sure that this is a very unfortunate injury to a great player for many years. We wish him the best of luck. I'll give you more information when we get it.